Hi, my name is Amanda Holler, and I will be presenting scoliosis. What is it? Scoliosis is defined as the lateral deviation of the spinal column, commonly in the coronal or frontal plane, that may or may not include rotation or deformity of the vertebrae. Scoliosis is a three-dimensional deformity of the spine and often affects the entire skeletal torso. The curves are often S or C-shaped. The pictures to the right depict a C-shaped spine, an S-shaped spine, a normal spine versus one with scoliosis. Etiology. The most common types of scoliosis causes are not known. These types are found in healthy, neurologically normal children. Idiopathic scoliosis are classified into three types. Infantile, when the deformity of the curve is manifested before 3 years of age. This is very rare. Juvenile, the curvature is presented between 4 and 9 years of age. This type is also uncommon. And adolescent. This is the most common type and makes up about 80% of scoliosis cases. The deformity of the curved spine will manifest usually after 10 years of age and until the growing ceases, and this is typically seen during the growth spurt just before puberty. Congenital scoliosis is caused by a disturbance in the vertebral development between the 6th and 8th week of embryo development. This is due to failures of formation and failures of segmentation. Formation failures indicate the absence of a portion of the vertebra. Failures of segmentation refers to the absence of the normal separation between the vertebrae. Neuromuscular scoliosis develops from a neuropathic or myopathic disease. It is seen in individuals who have cerebral palsy, muscular dystrophy, myelodysplasia, and poliomyelitis. Manifestations. The hallmark characteristic of scoliosis is the S or C-shaped spine. Other signs and symptoms include shoulders that are uneven, one shoulder blade may appear more prominent than the other, an uneven waist, one hip higher than the other, the entire body leaning to one side, unequal gaps between arms and the trunk, and pain. This is usually present in severe cases and is caused by pressure on the ribs or the crest of the ilium. If scoliosis is left untreated, it may progress to an extent that compromises cardiopulmonary function. Diagnosis. In 90% of cases, scoliotic curves are mild and do not require active treatment. In the growing adolescent, it is very important that the curves be monitored for change by periodic examination. Early diagnosis is important in the prevention of severe spinal deformity. Diagnosis of scoliosis requires a physical examination to look for the physical manifestations. The Adams bend forward test is a test used by pediatricians. During this test, the patient leans forward with his or her feet together and bends 90 degrees at the waist. From this angle, any asymmetry of the trunk or any abnormal spinal curvatures can easily be detected by the examiner. Scoliosis then is confirmed by radiography, which includes X-rays, MRIs, CTs, or CAT scans. Scoliosis is diagnosed in terms of severity by the number of degrees of the curvature. A curvature greater than 25 is considered significant, and curvature degrees exceeding 45 are considered more severe and often require more aggressive treatment. Treatment. There is no cure for scoliosis, but it can be treated and help reduce symptoms dramatically, and it depends on the degree of the curvature. For those with lesser degree curvatures than 20 degrees, they will not need aggressive treatment, and physicians will typically wait and see if it progresses into anything more serious. Treatment is considered for physically immature children with curves starting at 20 degrees. A form of treatment is bracing. It's used to control the progression of curvature during growth and can provide some correction. Those with curvature degrees between 20 and 40 are most likely to need the brace. Surgery is also another form of treatment. Instrumentation and spinal fusion is done in severe cases with curvature greater than 40 degrees. This is used to decrease the curvature. Instrumentation helps correct the curve and balance, while spinal fusion maintains the spine in the correct position. Therapeutic exercises do not reduce the curvature but play a part in helping slow the progression. Preventions and risk factors. Most cases are idiopathic, meaning there's no known cause, so there's no way to prevent it. Congenital scoliosis cannot be prevented due to failure formation or segmentation in cell division. Neuromuscular scoliosis can only be prevented when it's due to rickets. Getting enough vitamin D can stop this, or poliomyelitis, and getting a vaccination can help stop this. Some myths about scoliosis include wearing a heavy backpack or having bad posture will cause scoliosis. Another myth is that family history means you will also have scoliosis. It's not true because there's not been enough evidence found to link family history with scoliosis. Risk factors include age. Signs and symptoms typically begin during the growth spurt that occurs just before puberty. In girls, the growth spurt usually occurs around 9 to 14 years of age. In boys, their growth spurt occurs later, typically starts at 13 years of age. In sex, being female increases the risk, and females have a higher risk of worsening spinal curvatures than males. Complications: lung and heart damage. In severe scoliosis, the rib cage may press against the lungs and heart, making it difficult to breathe and harder for the heart to pump blood. Back problems. Adults diagnosed with scoliosis as children are more susceptible to have chronic back pain than the general population. And being self-conscious about appearance. As scoliosis worsens, it can cause more noticeable changes such as unlevel shoulders, uneven hips, and a shift of the waist and trunk to one side. Here are my reference citations, and here are my image references. Thank you.